Hi, I'm Amy.
And I'm Steven.
If your doctor has told you that you need to do a bone marrow aspiration or biopsy, our video is here to help you understand what you might expect when you go through the procedure and some helpful tips.
I tried to have my bone marrows on a Thursday, so I could then work from home on a Friday. I usually would have to take off the whole day of the bone marrow, just because I wasn't in the best of moods to want to go back to work. Now, I realize that some of you may not have this luxury, but I was very fortunate that I could do that. There were two people that performed the test, usually one male and one female. I tried to talk to the technician performing the bone marrow. This helped me stay calm during the procedure. It's very important to have someone drive you to the procedure and drive you home. Yes, you can drive if you had to afterwards, but you probably won't be in the best of positions to do that. My back was sore and it wasn't always the easiest to walk around right away. After they did their procedure, they would bandage me up. Usually, if you had an aspiration, I'd have to wait 24 hours after being bandaged before I could take it off. And if I had a biopsy, I'd have to wait 48 hours before I could take the bandage off. This meant I couldn't wash the area in that time frame either. Sleeping can be a little bit challenging the first night because of the bandage on your body. I'm a stomach sleeper, so it wasn't as big a deal, but if you sleep on your back or side, it may be a little more challenging. I would bring a stress ball with me to help with the pressure and pain. Every time they pushed a needle into me, I'd make sure to squeeze the stress ball, and this would help make it not hurt as much. I tried to make sure when I was at home after the procedure that I would sit comfortably on a couch with some pillows around me. I was on a trial and I had to have bone marrows every 3 months for the first year and every 6 months for the second year. For those of you that are new to CML, do not freak out. It's not normal to have 7 bone marrows over 2 years. I was on a trial that required me to have a lot more than normal. These days, generally you need to have a bone marrow when you first get diagnosed, and otherwise you might not need another one. And the only chance time you might need another one after that first one is if your results change or if there's a mutation or if your doctors are concerned about something. But if everything goes as planned, you should only need 1 bone marrow now.
It's important to get educated about this disease, and when you get educated, you can be better prepared and feel more comfortable to know what you might experience as a survivor. Thank you for watching today.
Together we heal.